Hey guys, it's Sabrina. So today I'm going to be talking to you guys about how my inpatient birth has been going. So I'm going to be talking about my first week, which was actually 2 weeks ago. I didn't get to film. But for my first week, I did OB-GYN, which was very interesting, very different. So I had never actually seen a baby being born before, other than myself, because I have like a home video, but I don't really get to see like much in it. So this was my first time seeing that, and it was crazy. So we were there for a whole week. Our schedule was from 6 a.m. to about 5:30, 6 p.m. So it was pretty long, very long days. Tiring. There was a lot of standing and walking around and moving and stuff, which was good. Could have used a little bit more sitting, but that's okay. I'm starting to get used to like the standing aspect of clinical rotations, and I have to get ready because next week I start surgery, so there's not going to be much sitting there either. So we started off my first day with me actually getting to do a vaginal birth, and it wasn't like me specifically doing the vaginal birth. On my first day I actually just mostly watched a vaginal birth. And that was still a lot for me, even just getting to watch. Like, I can't even imagine actually going and doing the vaginal birth. But it's crazy. So I started off the morning at like 9 a.m. and the birth actually happened at like 2 p.m. So labor can take a super long time. So you just kind of sit and wait and watch and go check to see how her cervix is dilating and how the cervix has effaced and where the baby is. With regards to like the opening of the cervix, and they have like different numbering, lettering, coding systems, and that's how you figure out when it's time for the baby to come out. So usually when they reach 10 centimeters and like 100% effacement and the baby's basically coming out of the cervix, she is giving birth. So it's really interesting like what they do to help with speeding up like the laboring process, and just like what you have to do if something goes wrong, and like reading fetal heart tracings and all this crazy stuff. There's a lot that goes into it. So that was really interesting, and I definitely learned a lot. Even though we were only there for a week, I feel like I got so much knowledge thrown at me. So that was really cool. So anyway, I watched vaginal birth, which is probably the most terrifying things I've ever seen in my life. I don't know how women do it. I'm really proud of us, and it's crazy what our bodies are willing to do to have babies and can do to have babies, but oh my gosh, does that look painful. And she was definitely suffering a lot, which is really hard to just watch how much suffering a woman is going through to get that baby out of her. But it's just like, I don't know, it's crazy. So she's sitting there, she's pushing, the doctor is trying to help with the baby. You usually just put your like 3 to 2 fingers on the baby's head. Once the baby's head starts to come out, the baby will naturally rotate on its own to one side, so you kind of just like follow the baby and hold its head like this. And then usually if there's nothing wrong with the shoulder, it should just come out on its own. Basically you just kind of push the baby's head down, you see the shoulder come out, and then you grab the baby's neck like this, grab its feet as it's coming out, twist it over, and you got the baby. And then you just suction out its mouth first, and you suction out the nose, and just wait for the baby to start crying and stimulate it if you need to. So that was actually really interesting to see. I think the most scariest part to me was just seeing the head come out. And so far, every time I've seen the head come out, it kind of just like explodes out of there, and there's not usually enough room, and there's tears, and it looks so painful. And I saw like some horrific tears. There was one where we actually had to do like a episiotomy on one of the moms because the baby, it was her first baby, and she just needed some help. I saw a vacuum delivery as well, which was fascinating. I never seen anything like that in my life, and that was crazy because you're just basically tugging out that baby's head and trying to get it out of that vagina, and it's like not coming out really, but it's coming out, and the mom has to keep pushing, and you're tugging, and I'm like, oh my god, is everything gonna just rip? It's crazy. I don't even know, guys. I don't even know. So it was really cool. I got to hold a baby after it came out, and that was scary. I was like, like, what do I do with this thing? Oh my god, what if I like drop it? And I was like freaking out. I had it for like 2 seconds and I gave it to the nurse, but I was still like stressed out about dropping it. That's like the #1 thing they say, do not drop the baby. And those babies are really slimy when they come out, and they're kind of like hard to hold on to. So I was terrified that I'd drop one of them, but I did not drop it, so that was good. And I don't know, some of the moms were so tired. They were like, I can't do this anymore. I'm gonna give up. I can't push anymore. Like, I can't even imagine what they were going through. I felt so like bad for them. Like, I can't help you. I just have to watch you and hope for the best. And even with like an epidural in, which I think mostly everyone had an epidural, they were still in so much pain, and it was so sad. So not exactly looking forward to that, but I did decide that I think I like vaginal birth more than C-sections. I saw a C-section, and to me that was the most violent thing I've ever seen in my life. You kind of just cut open the abdomen, just cut through all the layers. You cut open the uterus, you push that baby out, and then you sew everything up together haphazardly. It's like, to me it looks like you're like a massacre of the abdomen. So I'm not a big fan of C-sections. I know, and it's so weird that the patient is awake too. They're like awake behind the sheet, and they don't even know that you're massacring their abdomen, which is kind of crazy to me. There's like a lot of tugging and pulling and ripping, and just not my thing. Like, I think I'd rather tear my vagina open, which also looked really painful, than tear my abdomen open. So I don't know. It was definitely an experience. It was very eye-opening to be able to see both a C-section and to be able to see vaginal births, both with vacuums and without vacuums. It was really, really cool. When you are a first-time mom, it takes forever for the baby to actually get out. Like, every push and the baby's like barely inching out, and it just takes forever for the head to finally come out. So you have to be super patient, and I don't know, I just feel like the mom suffers for so long until she finally gets that little thing out. I liked OB-GYN in its own way, but I don't think I could see myself becoming an OB-GYN doctor. It was just too much for me. Like, I don't know, I think I take it too personally because I'm a female. And the funny thing is that all the OB-GYNs, like the residents, were basically all female. There was like one male that I met. So it is definitely a female dominant job right now. All the older OB-GYNs are practicing physicians, are males, but all of like the residents and stuff were females. So that was interesting. There might be like a shift to having more female OB-GYNs. But yeah, that's how my week went. I just kind of like shadowed and followed the resident around. Helped them in any way that I could, wrote notes when I could, interviewed my own patients, which was really cool. I started to get better at like talking to my own patients, like real life people, not standardized people, and that was really interesting because for every specialty you kind of have to cater the interview in a specific way. You always do like past medical history, family history, social history, your current history, all that stuff doesn't change, but when you ask specific questions, it's kind of geared towards what specialty you're doing. So I was there for 5 days, for 12 hours basically every day. It's definitely a culture shock for me, just being in the hospital and not being in a classroom. It was so different. I was like, wow, this is nothing like I'm used to. I liked it, but at the same time I was like, I don't know, it's uncomfortable. Like, when you start doing something new, you always like freak out because you don't know what you're doing. You don't want to be in the way. You don't want to annoy people. You like don't know what your position is as a medical student. So there's definitely a learning curve from going from a classroom straight into like the hospital. So that was very, very different for me. I also got to like practice suturing because I saw gyn surgery as well, which I don't know how big of a fan I am of surgery. I don't really think it's my thing. It's way too stressful for me, and just like there was a lot of like, I got pimped a lot and I didn't really know how to answer the questions, and I just felt like I was under a lot of pressure the whole time, which just was not my thing. I was definitely dead tired after having a full day of surgery. So I'm not sure if I'm a future surgeon, but we'll see after I do surgery these next 2 weeks if I change my mind. But definitely not really interested in gyn surgery. Too much vagina, anus, that region, not really my thing. But it was interesting because I got to participate, got to like hold clamps, got to scrub in, helped with doing some sutures, so it was really, really cool. I got involved and that was really awesome. So we had one half day of surgery, but my half day ended up being actually a full day of surgery because we had so many cases. So it was cool, but I don't think it was really my thing. And we actually got to go to 2 different hospitals. We did a rotation at UMC and then a rotation at Sunrise throughout that week. So we got to experience like OB-GYN in 2 different hospitals, which was really cool. So it was really, really interesting, different. But I think I am slowly figuring out kind of what I like and what I don't like. So that's really helpful at least. So that is how my first week of clinical rotations went OB-GYN. If you guys are starting your rotation OB-GYN, I hope you get to deliver some babies, see some C-sections. But that's it for what I did in my week. For like resources that I use, I was there for only a week. I did use online med ed videos and kind of just prepared by watching the obstetrics and the gynecology videos. And I also read the blueprint book, the obstetrics and gynecology blueprint book, which was really helpful to kind of like prepare and get the basis for what to expect on gyne surgery. So thanks so much for watching, and I'll see you guys soon.